Implementation of informatics in schools. Informatics and school nursing introduction. With informatics, you are able to have hearing and vision screenings, immunizations, all inputted into your system. You have the ability to track data, including communicable diseases, injuries, and even interventions that were implemented. You are also able to put your healthcare plans and any physician's orders into the student's file so that if another nurse is covering your school, they're able to find the information easily. You're able to input medication and track the medication as it's given to ensure that daily dosages are given. How important is it for us to have our informatics in schools? Well, like I said, it gives us the ability to track data. That data can help us to find common health trends. For example, if you have a bunch of students that come in with high fevers, itchy throat, runny nose, you can track that data to see maybe if there's the flu or a cold or something going around the school and implement interventions to help in other students not getting that, as in cleaning of the school, cleaning of the buses, all of this. You also have neat, accurate documentation of the student. So you have an area where you put in your healthcare visits, and it's neat and you can read it all and it's not a bunch of scribbly writing, and it helps a lot with being able to go back and look at that information. You can keep a record of immunizations, a record of diagnosis and the treatment plans, which includes doctor's orders, psychologist orders, anything that you could have. You can keep a care plan for the student's record. You can record the number of times the student comes to the nurse. This is helpful for when a student is missing a lot of class. You can work with staff to ensure that the student is healthy by maybe referring them to a doctor or whatever needs to be done. You have the ability to compile the information and share the data with staff, community, and state. So like my example with the flu, if there's like an outbreak of the flu and you have like 30 kids a day that you're sending home, you can share that information with your staff, with the community, and even with the state. And you can help to educate on ways to prevent the flu. And it also gives you the ability to recognize trends in data and find areas where further assessment is needed. This can be seen, say, with substance abuse. If you have a high number of substance abuse cases, you can work with the state and staff on educating on like the risk of using substance abuse and even finding out why there's so much substance abuse in the area. The National Association of School Nurses is one of the articles that I found. In one of their articles, the electronic health record, it talks about the importance of electronic health records and how it gives you the ability to document and share the information that you get, improved quality and safety and efficiency of care, data management, which we've discussed, documenting, reporting, sharing that information with all members of the healthcare for the student. So say you have a student with diabetes. It's important to also let their teachers know, the principals know. Let people know what to look for for hypoglycemia or hyperglycemia. It's important to really share that information so that you can keep the child safe at school. It allows for organized care, data analysis, and quickly recognize healthcare trends. Another article I found was the Online Journal of Issues in Nursing. It discusses like school nurses and their importance. It talks about using informatics can help influence student health. You can encourage academic status. So like we discussed, if they're missing a lot of class, going to the nurse's office, you can find out what's going on with them, get them the help they need, and then help them in school with like a 504 plan or an IEP plan or even just your healthcare plan and communication with staff so that they're getting the best education they can and with their optimal health. It joins healthcare with education like I just referenced. You can coordinate care. So if a student needs to come in every day before lunch to check their blood sugar, you are able to work with your staff and be able to say, hey, let the student out 10 minutes early so they can come check their blood sugar and stuff before they go eat. You can also advocate for your students. If you have a student that has a medical diagnosis, you can advocate, like I said, with the 504 plan, IEP plan, just talking with your staff, letting people know what's going on so they're not punished for having to leave class because their blood sugar is high or their blood sugar is low, or they fail a test because their blood sugar is low. You're able to advocate for your student and coordinate and organize with the staff, student, community, and health education. You have your paperwork, you have your individualized healthcare plans, you have your visit documentation. All of this is so important to have available for students. Another article I found was with Global Health, and it's about being a school nurse. And it talks about how school nurses combine health with education. Like I talked about, if you have a student with diabetes and they're not doing good in class because their blood sugar is always high, you can work on interventions to help them. It also helps with tracking and preventing communicable diseases like we discussed, like with the flu. Management of chronic illnesses, for example, the diabetes, acute illness and acute injuries. You can document these and keep a close record. Health screenings, hearing and vision, BMIs, any kind of health screening that you need to do, you're able to keep in the informatics system. And then as well as the education programs. And you're the health liaison. How important it is to advocate for your students. The conclusion of my articles is that school nurses are responsible for documentation. Visits, screenings, immunizations, medication are just a few of these things. You also have to coordinate their care, work with their teachers, educate about signs and symptoms, educate about prevention, so much. Data management is a big one. Being able to look at the end of the year and organize your data and find out how many acute illnesses you had, how many kids you sent home, how many substance abuse cases you had, how many lice cases you had, and then analyzing that data to recognize healthcare trends. If, say, in June you had 35 cases in 1 week of lice, you know that you need to educate your staff and your community about lice. And you're able to plan that education and go out into your community and help people. And it also helps with coordinating the care of the students. Legal and ethical issues for school informatics include student privacy. With HIPAA and FERPA laws, you have to make sure that that student's information is private. So if a student has a urinary tract infection, you can't just be telling everybody in school, hey, this student has this. You have to really make sure that you're ensuring the student's privacy and you're only letting people know that it infects. So for instance, with that case, if you can go to a teacher and just say, hey, let the student go to the bathroom as needed without having to get into all the details, that helps in maintaining the student's privacy. There's lots of confidentiality laws like we talked about, the HIPAA and FERPA. It also, another legal and ethical issue is who is allowed to access the student's medical information. In our schools, the only people that have access is the nursing staff. No administrators, the superintendent, nobody else has access to the student medical but the nursing staff. Who is in charge of evaluating the system? In our system, the charge nurse is in charge of evaluating, but the nurses all work together with her to make sure that all the information is gathered. What information is allowed to be shared and whom is it allowed to be shared? Well, of course, this goes with HIPAA. You can't share information if a teacher just comes up to you and says, hey, I know so-and-so, why were they in your office today? That's none of their business. If they're not in their class and it doesn't directly affect them, it's none of their business. Risk assessments are another legal and ethical issue. When you're assessing a student for risk of suicide, that's not something that you need to get out. The only person that we tell normally is administration and then the parents as we're sending the student out for a threat assessment or to the emergency room or whatever we decide to do with them. And reporting that data. You need to make sure that when you're reporting the data that it's numbers. It's not names. It's numbers. When implementing informatics into the school, You need to build a team to begin the system selection. So with the school, you're not just going to have nursing staff. You're going to have administration, teachers, secretaries, a whole team of different departments. And you're going to pick a system that works best with the school's vision. Then you want to train members from each department as well as the department members. You need to have trainings for all the staff and frequent trainings. And make sure that all new information is given to the staff, and then that you have refresher courses. As with the schools, we do this during teacher in-service days. So at the beginning of the year and throughout the whole school year, we work on learning our system more. And then you want to have an assessment to make sure that they understand what they're implementing and how they're implementing, and that they're doing it correctly. This can be done by the lead team member for each department. Implementation of informatics. We use Infinite Campus in our system for our school. It's an informatics system that's used in a lot of schools. It allows students access to their files. The nurses are able to chart their visits, the immunizations, everything that we need. We're able to upload the doctor's orders, and we're able to compile those files for more data. In the future, the National School Nurse Association hopes that the informatics that the nurses use will actually work with the healthcare providers. They also hope that wearable medical technology like insulin pumps will be able to be monitored and analyzed in the nurse's office, so that information will be sent to our computers. There's a lot of hopes for preventative care, and these changes will affect the school nurse by allowing us to have better communication with our providers and to take better care of our students. The future is limitless. Conclusion. Need accurate record keeping, ease of use, organization, data management, data analysis, trend reorganization, education of students and staff and community, future ability to communicate with healthcare providers, future ability to monitor, analyze, and wear devices, and prevention, all of which we have went over thoroughly in this presentation. Thank you guys so much for watching.